What's the meaning of abscess? Abscess. 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 An abscess is a collection of pus in the body. Pus is a thick, white or yellow fluid that contains dead white blood cells, bacteria, and other debris. Abscesses can form anywhere in the body, but they are most common on the skin, in the mouth, and in the lungs. Abscesses are usually caused by bacteria, but they can also be caused by viruses, fungi, or parasites. Abscesses can be small or large, and they can be painful or painless. If an abscess is large or painful, it may need to be drained by a doctor. Drainage is the process of removing the pus from the abscess. This can be done with a needle or a small incision. After an abscess is drained, it is important to take antibiotics to prevent the infection from spreading. Abscesses can be serious, but they are usually treatable with antibiotics and drainage. Here are some of the symptoms of an abscess: pain, swelling, redness, warmth, tenderness, fever, chills. If you have any of these symptoms, see a doctor right away.